Hello, everyone. Welcome to our Nursing and Allied Health podcast. My name is Shumaila Sheikh. I'm one of the social workers within Cleveland Clinic Abu Dhabi. I have with me today Maryam Al-Mamri, one of our social workers, and Nasra Suleiman as well. We'd like to introduce ourselves initially, describing shortly and briefly what our role is within the hospital, and then share it in with the social work theme for this year, Social Work Day, which is on the 19th of March, highlighting shared future for transformative change. So if I can ask Maryam kindly to introduce herself briefly with your role and the service line that you cover.
First of all, thank you for having me on this episode of the Nursing Podcast. I am a clinical social worker responsible for the Oncology service line at Cleveland Clinic Abu Dhabi. I started working in this field after gaining a great experience from the clinical setting, from different specializations or institutes in the hospital, and also volunteering in the community in order to get a comprehensive picture of the patient's journey from different aspects. And working in the clinical setting, usually as social workers, we receive different consults to provide the necessary support for patients, whether working with the newly diagnosed patients, patients in the middle of their treatment journey, and also patients who are being cared for by the palliative care team.
Thank you. Thank you very much for the introductions. Nasra, please, if I can ask you to describe what you do within the hospital setting as well.
Thank you, Shumaila. My name is Nasra Suleiman. I am one of the clinical social workers in the social work team, and I am licensed by the Social Work Board in Minnesota, USA. And it's my pleasure to be in this podcast, just showcasing the work that we do as social workers here in the hospital. So what we do generally is that we receive a lot of referrals, a lot of consults from different clinicians here in the hospital to help patients overcome challenges regarding their mental health, emotional well-being, and overall helping them if they need any support with resources, and do counseling as well if needed. And as my colleague mentioned, we have different specializations within our team. Some of it is oncology, we have transplant, we have HVI, we have palliative care, and some of us are certified to be in these services. So I'm very grateful for this opportunity, and I thank you for having us. Thank you.
Thank you very much, Nasra. I'll explain a little bit about what I do within the hospital in my role. I'm one of the certified transplant social workers within the hospital, and with the MCS certification, which is the mechanical circulatory support. I support as well within the service line for transplant, for the safeguarding team as well, the safeguarding cases that we have come through ED or in the inpatient floors as well. We all specialize in one area, but at the same time, we help each other out with consults that we come in, which is the daily workflow that we have within the team. So coming back to our topic, if I can share with you too, the shared future of transformative change. Maryam, can you describe how you feel your work in oncology service line is transformative for our patients and where you see this going?
So as a clinical social worker, I believe that the innovation and change is the nature of the social work role in the hospital. We work face to face with our patients who are coming from different backgrounds, different nationalities, and different experiences. We try, each one of them, he have his unique story, his unique needs, and we try to identify in which area we need to intervene. Some of the patients may require financial support. Some of them, they have some family dynamics and issues that may require the intervention from the social worker. Some of them may require our counseling during the treatment journey, our emotional support. Each one, our intervention, it may be from the same aspect, but will be in a different way, in an innovative way for each patient, because we are dealing with human beings. Each one is different and unique from the others, and some of the support may be internal from us and from our colleagues from the multidisciplinary team from different specialization, such as the psychiatrist or psychologist or the palliative care physician, for example. And some of these needs can be met from other external services, such as the charitable organizations, the societies that are, for example, supporting cancer patients by arranging home visits or visits for the patients inside the hospital. So we try to come up with the new changes to the patient life, just to enhance his well-being and ensure that he gets the necessary support during his treatment journey, even after the discharge from the hospital.
Thank you so much. That's very, very pertinent. And I think what you've mentioned around the support that we provide to patients, and being an oncology patient, if they're newly diagnosed with a condition, that is quite life-changing for a patient, depending on the severity, acuity of the condition.
Exactly.
So being able to support them at that vulnerable time, when they need all these services to be in place, is quite pertinent and is transformative in itself, because a lot of these patients will go on, carry on in life and work and do other things in the community, with their treatment going on alongside or after having recovered as well. So
Exactly.
that is quite pertinent and important. Thank you very much for sharing that. Nasra, coming to the same theme as well, the shared future for transformative change. I know you've mentioned the general social work aspect of our work here, but is there any particular example or any particular service line that you would like to mention where you feel transformative change takes place and is quite significant for our patients?
So first of all, I want to say that change comes from within. So we, as social workers, believe that part of our advocacy work for patients is to start where the patient is, and making sure that patient comes first, working with them and their families to instill hope in them and try to look into the future with with good hope and with the feeling that they are going to be better and go back to their normal life or baseline. So I work for the Neuro Institute, and there we see a lot of stroke patients, and we see how the team there work so hard into making sure that the patients and their families, come back to their work and school and whatever they were doing before coming to our hospital, and putting patient first, meaning that making sure that patient is aware of what kind of condition they have, and making sure that we are transparent with the patient and helping them as social workers understand what are the challenges that they're going through, and taking them step by step into learning how they can adapt and come back to their strength, and to make sure that they go back even stronger than they came to us. So I think that with the neuro team and the other teams as well, making sure that patients are aware of their illnesses, they are aware of the resources around them, whether internal, external, as my colleague said, and making sure that they are hopeful. They are, supported with our services, and just making sure that they are in the best place to recover and to find hope.
So the element of hope after having a massive change, possibly in their baseline after suffering a stroke. Thank you for that. Thank you. That's very insightful. Thank you for sharing that. So from the work, I will focus on the transplant service line, and I find the transformative change really truly comes from again, supporting the patients that may require transplantation, solid organ transplantation. So that could be heart, liver, lung, kidney. as examples, where we follow through psychosocial assessments for these patients as recipients, and if they're living donors, as donor assessments. We conduct these assessments that are international assessments that are followed through an interview with the patient as either an outpatient or an inpatient within the hospital setting. Recommending and supporting the transplant service lines for that particular organ as to how best to support the patient, whether it's a psychological, psychiatric need, whether it's financial support, or whether it's knowledge and understanding and insight of the patient that they may have or may not have for that matter, and how best we can go about making the patient the most suitable candidate for transplantation, and supporting them and filtering them in and not filtering them out from the process, so giving everyone a fair chance. I feel this is this is linked into the transformative change for the theme of this year for social work. And I feel very strongly, I don't know how you guys feel, but I think we all work in the transplant service line together, and we have various assessments that take place during the work week that we have. And that there are many times when we attend our committee meetings for our organs, and we see the team, the committee meetings making decisions for patients and including patients, and then take into consideration our psychosocial assessment, which bear very heavy in those discussions. Is there any example or anything that you can think from that comes out that really jumps out at you, or any other service line that you've worked in that jumps out with transformative change for a patient, particularly, as we've talked about patient care being and patient-centered focus?
So for me, I think that with the transplant, I think attending these meetings are very transformative in itself, because it takes, as you said, in consideration the importance of putting patient in the center of our care and making sure they are involved in every step of the way, and involving them into their care. But I see this in all of the service lines that we cover as social workers, and I see this in the overall message and practice that I see around in this hospital. So I think that in general, most of our work is centered around the patient. The patient comes in the first in every single thing that we're doing here, and we practice as clinicians. So I'm really grateful for the teams that I work with, including my colleagues here as social workers. And I feel grateful for the other teams that work with us as well.
The multidisciplinary teams that we work with, because we wouldn't be able to do any transformative change without all the teams that we communicate and liaise and collaborate with. So I think that's really the crux of it. The transformative change comes from working collaboratively within our hospital teams, interdisciplinary teams and disciplinary teams. Thank you for that. Anything from your end, Mariam, that you would like to add?
So Shumaila, I believe that working in this country, in the United Arab Emirates, it's a unique culture. We have people from all around the world, and even the original people who used to live here for so many years, they have their unique traditions. They value the religious aspect, and handling such cases for these people, it makes us come up with innovative ideas, new ideas, just to help them, just to try to explore ways, and other organizations come up with new policies, with the new ideas, just to support them. So in this area, I feel that we have so many opportunities to enhance and to develop in the future, and even in the meantime, we are trying, since Ramadan is coming, we are trying to focus more on the religious aspect and how it can help our patients during this month to cope better, and even for their families. It's a unique period of time that can really help the patient.
It's a very spiritual time of the year.
Yes.
And I think in itself, the month itself brings a lot of spirituality and transformative change for many people.
Exactly.
And as we know holistically, when we treat a patient You've got the medical aspect, but you've also got the spiritual and the psychological aspect of a patient. So when we conduct our psychosocial assessment, we take into consideration everything for the patient, within the patient and external from the patient as well. So it may be their family, it may be their associations or their alliances with other community members, which is very, very important. And all of these things help in that transformative change. Thank you. That was really, really insightful. Is there anything else that you would like to shed light on with regards to the work that we do here in the hospital that assists our patients in...
Yeah, sure. So I can add that providing training is very important, and I find that since I joined here in the hospital, I've had the opportunity to had a lot of trainings here, comprehensive training in order to support our patients. So I see that this is a helpful step in order, to provide good and excellent services to our patients. So I'm grateful to have these opportunities, and I think it is essential in order for us to talk about any transformative change. Change comes from within. So if we can change to the better, and and as we know, clinical practice changes by the minute. So if we are able to match that kind of change that is happening, then we can provide the best and excellent service for our patient.
That's a very good point that you raised, Nasra, because maintaining your skill set within your profession is highly important. Evidence-based practice and best practices and standards of care, maintaining and upholding them are really, really essential. So I think, like you said, the education side, or the, as we call them, the CMEs that we need to have for our revalidation or recertification, whether it's based in the US or UK or within the UAE, is really, really important. So transformative change for the patient is indirectly achieved through the professionals maintaining their education base and upskilling themselves. And as we have in our team, I would say people have taken on those roles of attaining certain certification or in the process of doing that, depending on where they are within their journey in the hospital. You mentioned that you're new to the hospital, or since you started. Tell us a little bit about your journey when you started working here and how you found the hospital or your team members to be.
I'm very grateful for joining Cleveland Clinic Abu Dhabi. I've started not very soon, but I'm very happy to go through the process of training and preceptorship, and also found a lot of support from my colleagues here, social workers and the nursing team in general, and from all over the hospital. Like whoever I met was very supportive into my learning journey, and that's why I am very grateful for the trainings that I received. So yeah, my journey was very smooth. I find myself home here in Cleveland Clinic Abu Dhabi, and I find it that everyone here is supportive. So yes, very, very happy and supportive kind of.
So this has been a transformative change for you as well, in a way.
Yes.
Excellent. Mariam, share a little bit about yourself, how you joined.
Just to add to what Nasra said, we are so lucky working here as a clinical social worker at Cleveland Clinic Abu Dhabi, because we are given the opportunity to be specialized and certified in specific areas. For example, in oncology, the palliative care social workers, oncology social workers, transplant social workers, and whoever would like to specialize in specific areas to provide the right support that our patients need. There is so many opportunities for the social workers here. So I'm very grateful for that, of course.
Thank you for sharing that. When you joined, tell us a little bit about your journey when you joined the hospital specifically.
Yeah, so I remember that when I joined the hospital for the almost first year, I had the opportunity to work in different institutes, gain experience from different areas, attending so many committee meetings, the MDTs with the multidisciplinary teams, discussing cases. Everything was new new to me, but I had the opportunity to explore everything in the hospital. So giving these opportunities, these chances to develop myself, and also to come up with innovative ideas with I don't know how to express it, but you feel that it is a wide area where you can choose whatever you need to learn, and sometimes you will be in situations that will push you to gain new experiences, to be in new situations that will develop your personality, your professionalism, your knowledge as well. So it is a unique place to learn and to work in.
Thank you, thank you. So I'll share a bit about yourselves, about myself, sorry. So I've almost been here for 7+ years, coming to 8 years, end of this year. So when it was a transformative change for me as well to join the hospital. It feels like a very long time ago, but I have had experience in the orientation, the initial orientation stages, where I was very well supported. I felt very well supported, and I was given the right tools to be able to do my role effectively and efficiently, I found. And I think that is very important to highlight and to kind of shed light on. Other than that, worked in the HVI, the transplant, the neurofloor, currently at the moment, the neuro institutes like yourself. And that in itself is transformative in that you get the opportunity to work in multiple areas, to touch on multiple areas, and it makes you, it gives you the ability to assess patients or interact with patients from an entire array of genre, whether that's a cardiac patient, whether that's a neurology patient, whether that's an oncology patient, transplant patient. So it gives you that exposure. It gives you that exposure to work with, and it gives you the knowledge of the resources in the community, and the resources that may need to be developed. So in a way, pioneering these resources. And I know, Mariam, you've been working on a lot of pioneering with other external entities for that. So whether that's the for patients that have addiction, alcohol issues, patients who have a specific religious need, patients who have had a massive change in their baseline with a physical disability due to a stroke, and then our patients with the transplant who need a new organ to sustain their life. So this in itself, tying it all together and bring it all back to transformative change for us as staff within the hospital and our patients, so we feel fully equipped and ready and prepared to be able to serve our patient group. So I think that's very, very important to highlight. Thank you so much for making it to the podcast and making this possible, and bringing your views and your ideas, very precious views and ideas, to the table to discuss today. And I'm hoping that perhaps we shall have more discussions and interactions like this that highlight and showcase the important work that the social work team conducts within the hospital. And in no way can we ignore or overlook the support that we receive from our team members, from our team manager and the team leads that we work with consistently during the time that we've been here. Right. So thank you so much.
Thank you.
Thank you. Thank you.